Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors. Let's look at today's topic.
Hello. Next in our series on breast health would be a very common condition that we all speak about, which is the fibrocystic disease or fibrocystic changes in the breast. So let me share my screen. So fibrocystic disease is something that is spoken about by many women in many a time when women go to doctors with complaints of breast pain, breast discomfort, breast lumpiness, breast swelling. The common thing that is mentioned is fibrocystic disease, but the term fibrocystic disease in itself is a wrong terminology. Maybe we can call it fibrocystic changes in the breast. So coming to the breast is an organ that is situated in the skin, like similar to your sweat glands and sebaceous glands, and it is made up of basically of fat cells with interspersed fibrous tissue to hold it all together. Milk producing gland cells, the ducts that carry the milk to the nipple through the areolae. And any of these structures can kind of swell up. The fibrous tissue can have changes, or the gland cells can become bulbous and cystic and feel different. And hence, when a definitive diagnosis or reason can't be reached, it is clumped together in something called the fibrocystic changes in the breast. Now, what we need to understand is, I'm sorry. Yeah. So at birth, the breast is flat, yeah, like we all know. And puberty, the glandular structures and the fibrous structures start growing. And through the entire adult life, the hormones make it go through various changes. So every cycle, with the effect of estrogen, progesterone, and prolactin, and so many growth hormones and so many other effects, the breast becomes enlarged, becomes engorged, and when pregnancy doesn't happen, it reverts back to the non-pregnant status. So this happens every cycle because of the effects of hormones. In pregnancy, you can see there's a remarkable increase in the glandular structure, which becomes even more and dense during lactation. And at menopause, something called involution happens when all the reproductive changes start shriveling up, estrogen and progesterone come down, and the breast starts shrinking in size, and all these changes start reverting. Now, when you come to breast, there is simply no development and involution. There is development and involution, but in between the entire reproductive period, right from puberty till you reach a menopause, the breasts undergo the cyclical changes because of the hormones, because of which various and these changes can occur in a precise mathematical way, which doesn't happen. Definitely where deviations from variation, which is called aberrations, happen, and sometimes it becomes abnormal too. So the key is to find out whether it is normal or a little bit of a deviation from the normal or an aberration, or is it something abnormal, cause for concern, and the main concern being, is it going to become cancerous or not. So the different feelings or the symptoms that the women present with include lumpy, rope-like or textured breast, swelling, pain, tenderness, pain in the underarms, and very rarely some amount of discharge. So things that can reduce these repetitive fibrocystic changes include having a healthy plant-based diet, maintaining a healthy weight, exercising regularly, wearing a good supportive bra goes a long way in managing these fibrocystic changes, avoiding stress, sleeping well. And if these changes do not subside with basic measures, and if you feel that there could be some kind of lumpiness, or you feel there could be possibly a swelling, then definitely go see your breast doctor. And definitely the doctor will examine you, which is called a clinical breast examination, and as needed, imaging will be done, and if required, biopsy will be done. All these three put together is called the triple test. Now, of these things, the two things we are women commonly present with, one in the reproductive age group, early part between the from puberty to 25, 30, 35 years of age, is the fibroadenoma, which is relatively normal. And there is one school of thought where every woman, if she was scanned in depth, in detail, there will be some focus of this fibroadenoma in every breast. So fibroadenoma is just a swelling of all the components put together in a breast, and rarely do they exceed 3 centimeters. Very rarely do they reach 5 centimeters. If they are more than 5 centimeters or multiple, or if they're causing pain, gross deformity, discomfort, and so on, it requires removal. Else, if a biopsy proves that the swelling that you have is a fibroadenoma, no further treatment is required. And invariably, they feel like a small marble in your breast, and when you feel them, they keep moving all around the place, and they don't cause any trouble. Most important factor is fibroadenomas do not cause pain. So if you're having pain and you incidentally put your hands on your breast and you feel a lump, there is a higher chance that it is hormonal changes that is causing the breast pain and not the fibroadenoma. And removing the fibroadenoma might not take away your pain. That is one thing you need to remember. The other common finding that is seen in most breasts is the breast cyst, and this is an involutionary change. It is seen in women after 30, 35 till about 50 or 60. A small water-filled space, like water-filled cysts, are seen in the breasts on ultrasound. Only when they become really big and painful is treatment required, and all you need in terms of treatment is simply putting in a needle and drawing the fluid out. That is, the doctor does it. Otherwise, no other treatment is required. Definitely excision is not necessary, because cysts do have a tendency to come back, because it is the normal aging process of the breast, and invariably the small cysts disappear on their own. So most of the time when it's very small, observation is the only thing that will be recommended. If it is very big, the cyst will be drained with a needle, and it is an outpatient procedure. So these are the things you need to know about the fibrocystic changes. Any doubts, please feel free to mail me. Thank you. Dr. Sujatha Rajnikanth, Velvom.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.